right, welcome everyone. My name is Obed Figueroa. I am the host of Lessons Learned. Diversity Premedical is presenting this opportunity to pre-med students and health science students so that they can learn from the wisdom of students that have walked your walk, hearing directly from them. So I'm pleased to present this to you. We have it with us today, Dr. Ansu Punnoose. She is an osteopathic physician, specializes in primary care at MedPeds in Baltimore. She's born in India and moved to Philadelphia at the age of 11. Dr. Punnoose is a first-generation college student and the only physician in her family. For undergrad, she attended the University of Pennsylvania, where she graduated with a Bachelor's of Arts, double majoring in health science and societies and South Asian studies. After graduating, she worked as a research assistant focusing on melanoma research before she was accepted to Touro College of Osteopathic Medicine. She graduated from there with her doctorate in osteopathic medicine and then pursued her residency in family medicine at MedStar, Franklin Square Medical Center in Baltimore, Maryland. Thank you, thank you, thank you. That was a mouthful. You've been busy. You have been busy. And I'm so pleased that you would give us this opportunity to learn from you, to listen.
Thank you so much for having me.
Absolutely. So, our intention is, again, to connect with the pre-med students and, have them learn from your experience, and what we'll do is we'll start with a couple of speed questions, just as a means to get to know you beyond the sciences.
Sure.
Okay, so if you could just give us your first thought when I ask these questions. Your favorite song?
Come
on.
I'm thinking. See, all the songs I know are Indian songs, but English songs. I like 98 Degrees. My husband and I danced to it. But Savage Garden.
Okay.
Truly, Madly, Deeply by Savage Garden. That's my favorite song.
Okay, so favorite book?
Harry Potter.
Interesting. Favorite car?
My first car, which was a Toyota Prius.
Oh, interesting. And then in terms of computers, PC or Mac?
PC for sure. Inside joke.
Android or iPhone?
iPhone.
Favorite guilty food?
Chocolate.
And your favorite color?
Orange.
Who's your favorite high school teacher?
Oh my gosh, Mr. Brooks. He was a crazy old man, but he was one of the best teachers we've had. He would throw chalk. He taught chemistry, organic chemistry, and pharmacology.
Interesting. And what was your favorite subject though in high school?
Biology.
Biology was? Awesome. Well, thanks for sharing that. Thank you so much. That gives us a little. And you are also married with children.
Yes. Sir.
So wow, life's been happening for you.
Life's been nonstop, but awesome. It's great.
Awesome.
Yeah.
So I'm sure they keep you busy.
Yeah.
As I mentioned to a previous guest, as a father that has had little ones and now adults, I promise you we'll live through it.
Well, they're still very little, so I'm looking for that silver lining soon.
You'll get to the point where they're driving their own cars and jobs and making dinner for you when you come home. Watch, it's gonna happen.
So my 8-year-old recently made breakfast for us, so that was very impressive, So yeah, we're getting there.
Awesome. So if you wouldn't mind, what inspired you to go into medicine?
So I wanted to go into medicine since I was 4 years old, not because of, any personal influence, but because when I was in India, I watched this show called Lifeline, which is kind of like ER here. And it was about doctors saving lives and, making all sorts of influence in people's decisions. And it was just very impressive. And little 4-year-old me was like, I want to do that one day. And, I didn't realize what a big dream it was back then because I grew up in a very small town in India. my parents, they both didn't go to college. They were both high school grads. And, for a little girl in a small town in India to become a doctor was just not very realistic. But my parents let me dream my dream, and I continued working towards it. And and the more I got to know about medicine, the more more I came across people who were, in the medical field, particularly doctors. The more I enjoyed it, and that's where it started.
No, thank you. So when you think about the experience when you were, in undergrad, and you're like, were there any subject matters that were like really challenging for you, and like how did you figure out how to, make it work so that you could pass?
Like a particular subject, you mean?
Yeah, subjects that you struggled in.
Yeah, so organic chemistry was not fun. I don't think it's fun for anybody. So I went to University of Pennsylvania for undergrad, and it was just a lot harder. At least it was my perspective. And physics and organic chemistry definitely, I am done with it. I'm glad I don't ever have to repeat it. But they were challenging. I do remember studying for one of my organic chemistry exams, and it was like 2 o'clock in the morning. I think I had already had like 4 cups of coffee, and I was just so jittery. And I remember crashing so badly that I literally had to wake up right before the exam. But we survived through it. But yeah, if I had to pick one class, it would be organic chemistry.
And then when you eventually got to med school, and like, did you feel like you still needed some extra help, or like, did you do it independently, or did you work collectively when you got into med school, dealing with that caseload of courses?
So I definitely worked with somebody. So I had just gotten married after first year of med school. So I wanted to be around my husband as much as possible also. But I did have one friend that she and I would do all our studies together. I remember before our anatomy tests, we would go into the cadaver lab by ourselves in the middle of the night, and it was great. So I do feel like during med school, you can't do it alone. You definitely need somebody else. For me, it was Priya Abraham. She was my,
Sure.
My buddy. But almost everyone I know, I think, did it with a small community. You need your friends.
Okay.
Yeah.
Definitely supports help.
Mm-hmm.
And so I'm just wondering, were there anyone, like, sometimes it's such a challenge to stay focused with something so demanding. Did you have any influences that were like, oh, this is too hard, maybe you should consider something different? Not, I'm sure they weren't being intentionally trying to distract you, but or deter you. Did you have any of those influences, like, oh, you should consider something else?
Absolutely. During my undergrad, actually, my pre-med counselor, who was supposed to encourage me, was like, maybe you need to consider something else. And I remember that was the first time I felt my dreams shattering, because I guess at that time I didn't have the GPA that they expected and the numbers that, on paper, I didn't look like a pre-med student applying to med school. And he told me, if I could consider something else, if I want to go into the health field, consider a different profession, but I will never become a doctor. I still to this day sometimes wonder if I should go back and be like, ha. But I am better than that. But, yeah. And then, and my family, because on one hand, they never stopped me from dreaming, but on the other hand, when I was going through certain difficulties, they did feel like, maybe I need to, open my options up and consider what other routes I can go through. But thankfully, I kind of stuck to my dream. I didn't give up, and here we are.
Awesome. And I didn't ask this of the other guests, but I wonder if you could share with us, what does a day in the life look like for you in practice?
Okay. So I right now am part-time because of my children. I have 3 little ones at home. So I work Tuesdays, Thursdays, and Fridays. But my Tuesdays and Thursdays are longer days. So I'm in the office from 8 to about 7. Even with telemed visits, because we're still seeing a lot of patients in person, I am here in the office. It is extremely busy. We're seeing patients every 15 minutes. Sometimes we're double booked. I have a lunch hour, which really becomes me finishing up my morning patients so I can start my afternoon patients. And then after all that is done and I go home, put my kids to bed, I open my computer to do all the charting from the day and the telephone encounters and the labs. So it's a pretty busy day. And, if I was working 5 days a week, I would imagine it would be similar. But yeah, it's nonstop and it's definitely demanding.
So, it's interesting being a non-physician. I would have assumption that some of that clerical stuff that you would have somebody else be doing that, but you're saying you do it from start to the end.
So we do have an awesome administration staff, and they do take care of a lot of things. So for example, if the patients are calling, if it is something that they are capable of answering, they definitely do it. But a lot of times it may be questions about medications or they have started something and they want to know if these are the effects they should be expecting. So those things we can't really ignore if we're talking to specialists and specialist calls, and they leave messages. So there are definitely things that we have to address personally. But we do have a staff that's doing a lot of this stuff behind the scenes.
So yeah, I'm glad we're having this conversation because you're making me continue to think of other things that could be helpful.
Sure.
Like when you're in the grind of study, and then being in practice is such a far reach. Now you're there. So could you help us make this connection to like, you see the connections that are so critical in being in med school, connecting to practice? Like, what are the elements that are so critical where absolutely these things apply to practice that you need to be aware of now, that they can't see right now because they're not in practice, right?
I feel like business administration should be part of med school teaching, because no matter which field you go into, whether it's outpatient or inpatient, there's just so much business aspect that as med students, we're just not prepared for it. So I am learning that as I am in practice now, but I remember coming in and I was just like, whoa, I have no idea what any of this is. So I do wish there was more of that, more business, healthcare administration teaching within med school itself.
Now, I remember you guys doing the OSCE labs. Did that help you to conceptualize, what is happening in practice?
No, those helped us to prepare ourselves for patients.
Okay.
So these are the different types of patients that are coming, but they don't prepare us for the behind the scenes of, for example, I order a CAT scan on a patient, and now insurance is like, no, you can't order this CAT scan because it's not necessary. Well, as a clinician who just examined my patient, I think it's necessary. So it's just like a lot of those conversations that I never, at med school, I just had to order it. I never thought about why this may be an issue. Insurance playing a role. Insurance is covering certain medications and not others. And as a physician, our priorities are patient and their health. So doing a lot of, prior authorizations and things that is not medicine, but is still just as necessary to provide the health.
Now, I'm thinking of the coursework that you're taking and kind of like trying to make a point of how significant it is to understand these elements before you go into practice. So like gross anatomy, would you agree that is so critical to understand?
Absolutely.
You know what I mean? Like, so what are the other areas that are so critical that they should understand? Yes, you absolutely really need to understand that deeply, because when you get into practice, what are the other?
So definitely gross anatomy and physiology. I mean, just knowing how the body works and what it looks like. Even, sometimes when I'm explaining things to patients, someone at some point I told me, you talk to your patients as if they're in a third grade level, no matter how smart they are. So, I literally sometimes if I'm talking about pain somewhere, I'm telling them about the anatomy, that your rib cage and your muscles and the heart is there. And so knowing that is definitely very important. And the physiology of how those things work is very important. A lot of these courses that we take in our first year of med school, histology, pharmacology, absolutely. All those give you the knowledge of medicine, of how the body works and how medications work. But then there's a whole other side of it, the mental care, for example. I will have a patient calling in for having sinus pressure, and the next thing you know, I'm talking about her anxiety, and a 10-minute visit becomes a 30-minute visit. And just to know how to deal with that, because we don't get enough mental health preparation in med school. We get maybe a month of psych rotation, but it's just not enough to really understand the mental aspect, especially as a family physician, that we need to address. So just having more, psychology and mental health studies would be important. As I said, a little bit of healthcare business administration knowledge, so just how hospitals work, how insurance companies build things, even learning the different codes of how to code something. I can order a test on a patient and it gets rejected because the diagnosis I put in is not necessarily the diagnosis they approve it for. So things like that make a difference, and that would make a better clinician, I feel.
Awesome. So how challenging was it for you, those exams that you take, the licensing exams? I mean, like, how challenging was that experience?
I hate them. So
it's hard.
I feel like I am not a very good test taker. So those were, pain. And if you're going to medicine, it's tests constantly, even as a provider, once you're become an attending, you still have to take them every several years. So starting with my MCATs, I had to take that twice. My first time around, I didn't do so well. The second time around was better. I did both the USMLE and the COMLEX because I didn't know where I would go for residency, so I wanted to take both. And they were hard. They were definitely very challenging, but I think I had to repeat one of my USMLEs, but it got better. I started learning, especially with the COMLEX and the USMLE, you kind of learn what kind of questions they're going to ask.
Mm-hmm.
So your test-taking skills do get better, but it's never fun.
Yeah, I was going to ask that, in terms of how do you improve on these and prepare for them. So you do have supports to prepare.
Yes, they have lots of, old exams. And so if you, depending on what resource you're using, they can give you the types of questions that are asked. Unfortunately, in medicine, things are always changing. But, so making sure you have the most recent information. But it kind of gives you an idea of the kind of questions and the format of questions that they ask. So, I learned just to do lots of questions, and kind of reviewing the answer, both if I was right, as well as if I was wrong, to know why exactly, a certain answer was an answer. So just preparing yourself, repetition is very, very important.
Okay. When you, if you were to speak to your younger self, would you have any advice for your younger self?
I would tell my younger self to be more prepared. I went in not knowing what to expect in college, kind of, I was finding my way, and I think it kind of affected my process, made it longer than I expected it to be. So definitely knowing why you're going, what you're going for, and how you're going to get there. I would say don't give up. I'm glad I didn't. And I would say, I know personally for me, it was a lot of prayer. I definitely believe that this was something that God had put in me. I felt like it was a calling, and I wanted to make sure I gave credit where it was due. And I do, even now, I feel like I am here because I have a greater purpose to serve. So I would definitely say, those three things: be prepared, don't give up, and know why you're doing it, and put God first.
Yeah. And that's one of the things I wanted to make sure that we touched on, is your faith and how your faith has helped you. Because I'm sure people, it'd be helpful for them to understand how that, if they, have a faith, that could help them pull through. How has that been influential to you?
It was very influential. I mean, I think I grew both as a person as well as a person of faith through this process. Especially every time there was a challenge, it was easy to give up, but knowing that, like with God, I felt like God was pulling me through. I definitely felt like there were miracles in my life, even through the medical process, that I couldn't explain myself, and I could only give credit to God, and even now, as I practice, I make sure that that is part of me, so I have like a Bible verse in my room that patients sometimes look at, and we actually talk about it. I've definitely prayed with a lot of my patients, and they've appreciated it. So I don't hide it because it is part of me, And if patients want it, it's available for me to share. But I do feel like it's made me who I am today. It helps me be more holistic because you can't ignore the spiritual part of somebody.
Absolutely. I was recently interviewed in the Bronx. I'll be releasing that to you guys soon by Bronx Network, TV Network. And we were talking about, and research supports this, that when a patient is treated by a practitioner that can relate to them culturally, there's just better reception. It's better insight because the practitioner didn't just read this. This practitioner has lived it, right? Cultural experiences. Have you seen that when you happen to come across a patient that can relate to you culturally?
Oh, absolutely.
Like, how has that been?
Yeah, so, I'm blessed to speak multiple languages, multiple Indian languages. So I've definitely had patients who come in, who prefer speaking in either Hindi or Urdu or, another language. And so we actually converse in that language. I mean, I can't say everything medical, but I'm able to relate to them and they love that, and so even when they call, they want to make sure that they are talking to me. I've definitely had a few patients switch, primary care to myself because of that. And I think it does make a difference because, this is another level you're connecting with them, and it gives them another reason to trust you because exactly what you said, you have lived what they have and they actually listen to you more, so I'll have patients who are like, I went to the emergency room, they gave me this, I don't know about it, what do you think, and your opinion matters a little bit more. So I think it plays a huge role.
Yeah, and I'm so grateful that exists, because it's important. It's important.
Definitely is. We're meant to be a community.
Exactly. All right. Well, thank you so much. I appreciate your time, and thank you to your wonderful family for allowing you to spend some extra time with me and just sharing.
No problem. Thank you for having me.
Absolutely. Thank you. We'll talk soon.
All right.
Very proud of you.
Thank you.